Welcome to Knowledge on the Go, the podcast brought to you by the PI programs team at Vizient. Having a mortality review process is important in healthcare. It helps drive quality improvement. We learn from adverse events, identifying and mitigating risks, and addressing ethical considerations. Tiffany Harvey, quality assurance reviewer at INTEGRIS Health, joins us about lessons learned from our recent collaborative. I'm Shannon Hale, Senior PI Program Director of Vizient, and your host. Tiffany, welcome. Glad to have you here.
Thank you for having me, Shannon. I've looked forward to this.
You participated in our recent Establishing a Structured Mortality Review Team collaborative. Tell us what drove you to enroll in the project and where you were with the topic beforehand.
Before joining the collaborative, mortality reviews were already something we were focused on at Integris, but we were looking for a more structured approach to make sure we were covering all the bases. We wanted to improve processes, identify those gaps, and ultimately driving better patient outcomes. When I heard about this collaborative, I saw it as a great opportunity to learn from other centers and refine our own practices. And honestly, it was about wanting to strengthen our new and upcoming team and ensure that we were doing everything we can to address these important issues in a more coordinated and effective way.
Fantastic. I often hear from participants that learning from other organizations is one of their favorite parts of the collaborative process. What were your goals going in there?
My main goal was to get a clearer sense of how other organizations were tackling their mortality reviews, how they were sustaining the traction with the mortality review team, and how we could improve our own approach. We were looking for new strategies, tools, and insights that could help us streamline our processes and make our reviews more impactful. At the same time, I did want to ensure that we were setting up a system that was sustainable and could be continuously improved over time. Overall, it was about taking our existing and previous work and elevating it, learning from others to make sure we weren't just meeting those standards, but pushing ourselves to do even better.
You mentioned sustaining the changes. That's a really important piece as you're making these changes. It's always easy to see the improvement, harder to sustain it. During the collaborative, what specific insights did you hear that impressed you?
Just how crucial it is to find that right time for those meetings. It might sound obvious, but it's something that can easily get overlooked. Until this collab, I didn't realize that and I didn't look at that. You can have all of the right people in the room, your key stakeholders, your experts, but if the timing isn't right for most people, it can really hold things back. Whether it's finding a spot in the afternoon or maybe even after hours, if it's not convenient for everyone, you're not going to get that engagement or traction that you need. It just made me realize how much timing can impact the success of these discussions.
We recently heard in a collaborative around how important it is to look at the timing of meetings, but also this one organization, they scheduled all of their meetings all at once for the year so that they got them on the calendar ahead of time. That was really impactful for them. Tell us about the work that you're doing around improving the mortality review team process, and how did you decide to look at this, and what was your approach?
We've been looking and putting a lot of focus on improving our mortality review process at Integris. It started with realizing we needed to involve all of the right people. We've recently made sure to bring in those key stakeholders. We've involved hospice, palliative care, transfer center, and even our analytics team. By getting those teams in the room, we're not just looking at our mortality data in isolation. Instead, we've been able to see the bigger picture and tackle those things from different angles, whether that's improving our communication, refining those processes, or addressing any gaps in care. Our approach has been about collaboration and making sure all voices are heard so we can be more informed with those decisions. And ultimately, our goal is to reduce our mortality rates, but what drives us every day is truly understanding that behind every metric are real people. We have patients and their families. We can never forget the human side of this work. It's not just about those numbers. It's about making a difference in the lives of those that we care for.
I often find in our work, if we're looking at certain metrics, maybe mortality, for instance, if we reduce mortality by 6%, always kind of keeping in mind that behind that percentage is a patient, is a family. It's been a few months since the collaborative wrapped. I'm interested to see where are you currently with your improvement work when it comes to mortality reviews?
Shannon, I cannot believe it's already been a few months since we wrapped up that collaborative. So we are still making some steady progress with the improvement. We have continued auditing 100% of our mortalities, which has been a crucial part of our process. But recently, we have taken a step back to look at the data with fresh eyes. Palliative care, hospice, transfer center, and our analytical team. What we have found is that we need to dive deeper into those areas like the intra-hospital transfers. We are so excited about the upcoming Vizient collaborative on that front. We are also focusing on our early death data that we're getting from CDB and expanding our hospice care efforts. These areas are where we see the most potential for improvement, and we're zeroing in on how to make those processes even more effective and impactful.
Great work. We spoke about this earlier in our conversation, sustaining change. That's always difficult. I always say it's easy to lose weight, harder to keep it off. How are you planning to sustain the changes that you're seeing in your improvement work?
To help with sustaining our improvement, it's definitely one of the toughest parts. At Integris, we're focused on making sure that these changes really stick over time. We're building a system where the improvements become a permanent part of our process. For example, we're not just implementing new practices, we're also making sure they're woven into our daily routines with clear ownership and regular check-ins. We're also relying heavily on feedback loops, whether it's from our team members or the data that we collect to help us refine some things. Ultimately, the goal is to make these changes so ingrained in our everyday workflow that they become second nature, making sure we're improving and not just checking a box like we so often do.
It sounds like you've got a solid plan for sustaining those changes. Recently, we've heard from organizations the accountability piece, who's accountable to do what, by when, keeping that data out there. That's key to keep it front of mind for everyone as we continue to see those improvements, and that feedback piece. Tiffany, as you look in your crystal ball to the future, what would you say your ideal mortality review process would look like?
As a former NICU nurse and former pediatric ER nurse, I could intervene in NICU and pediatric ER. I can't intervene with mortalities. My colleague and I, we would do our mortality review and pick maybe 3 or 4 cases a month and bring that to the table to our key stakeholders, our chief medical officer, our intensivist, our hospice and palliative care providers. We want those transfer center individuals in the room as well, case management, and our analytical team. What could we have done better? Should we have accepted this patient into our organization to begin with? Should we have involved palliative care earlier on in the admission? And hear from not just providers, but other parts of the team. We are definitely working hard, and we cannot thank you all enough for inviting us to these collaboratives.
Fantastic. My pleasure working with you.
Likewise.
Thank you, Tiffany, for joining us today and sharing your insights when it comes to the mortality review process. And thanks to you, our listeners. Please join us for more Knowledge on the Go. Subscribe today, like us, and send us your comments at picollaboratives@vizientinc.com.